Welcome back to Great Day Houston. We're coming to you from the Smith Clinic that treats all types of cancers, but in honor of Breast Cancer Awareness Month, we're talking about, well, breast cancer. So many times what separates a woman from the treatment that she needs is $1. And here at Smith Clinic, they help women who are uninsured or underinsured to access that treatment. For example, you met Cristina Tabernilla before the break. And Cristina, for you, you kind of hold the distinction of being the first patient to come through Smith Clinic. And as we mentioned earlier, it is over 5 years later, which in the cancer world means that you're basically cured.
Yes, ma'am. Cancer. You know, when you think of cancer, the first thing you're gonna put in your mind, you're gonna die.
Yeah.
But thanks God, I found the Smith Clinic.
Yeah.
They helped me a lot.
How did you find that you even had cancer? What was the thing that concerned you? Because you hadn't gone for a mammogram before, had you?
Yeah, no. Actually, when I woke up, it's a very hot Sunday morning, August of 2012, I said, what's this? I have a pain under my arm, and I immediately made a self-check. And then I found a lump, and I cried. I said, what's this? Is this cancer? I immediately called my doctor, and the doctor said, okay, Cristina, come over here in my clinic. We will do the check. And then they finally found that, you know, the lump is a suspect of cancer.
Right.
They immediately called me for a mammogram, biopsy, and ultrasound. And then there was a cancer. The doctor said, Cristina, find a good surgeon. Where in the world I can find a surgeon for my cancer?
Yeah, and then there are other places you went, and immediately up front, they wanted money. How much money?
Yes. Actually, I went to one of the cancer hospital here in Houston. They were asking me for a $25,000 up front to start the treatment. Wow. Oh my God, I don't have that big amount of money.
Most people don't.
Yes, I really don't. So a friend of mine said, don't worry, Cristina, we will guide you wherever you will get a good treatment, we will guide you.
Yeah, and you came to Smith Clinic?
Yes, ma'am. I found Smith Clinic. They gave me a good oncologist, Dr. Nangia. They started to find out, you know, what kind of cancer I have. They set up for like a test, and I'm in the history books of Smith Clinic. I was the one who was the equipment calibrated on me. Yeah. I was the first patient of Smith Clinic.
And they have the highest level of treatment here,
yes.
The highest level of doctors, the highest level
yes,
of the protocols that they have. You grew up in the Philippines,
yes.
And you have said how lucky Americans are,
yes.
because if you were back in the Philippines, you're not sure if you would have been able to get this kind of treatment.
Yes, ma'am. Growing up in our country, my memories of cancer were bleak. You know, based on my experience, I had friends like of my same age, they got cancer, and some of them already dead.
Yeah, and of course in America, you know, this is a great country, but still there are people who did not have access or do not have access to great health care, and that's what the Smith Clinic is all about. And I know Sue and Lester are so proud of you, and there's so many other people who have been able to come through here, access the best treatment, and you are alive today.
Oh yes, ma'am. I am so thankful. My heart belongs to Smith Clinic. My heart belongs to Sue. Miss Sue and Lester. First, God gave me life. Second, Smith Clinic helped me. The doctors and the oncologists, all the staff of Smith Clinic and Bentab hospitals, they are professionals, good caring people. They tell me I'm gonna, you know, live. I'm gonna have my life. I'm gonna be helping other people who has cancer, and now I am here.
So what do you have to say to somebody who we know has just been diagnosed?
Go find a good hospital, a good clinic. I tell you, even you have cancer, you can still smile. That's only cancer. Think God first. Second, go to Smith Clinic. This is designed for those patients that needs a specialty care. Deborah, did you have your mammogram?
You know what? Not yet. because I kept getting busy and kept putting it off and putting it off, but you're right. We can't put it off. We have to get it done.
You better have one, please. And to all other women, please get your mammogram done.
All right, so when we come back, I'm actually going to go get my mammogram and we're going to read my results on the air.